Today's topic is postmenopausal bleeding. What is postmenopausal bleeding? Postmenopausal bleeding is any bleeding that happens after menopause. Now, menopause is cessation of menses that happens for at least 1 year after around the age of 40 to 50 years. The average age of menopause in Indian women is around 51 years of age, and any bleeding, any form of bleeding after menopause is called postmenopausal bleeding. Hi, I am your gynecologist and women's health advocate, Dr. Ekta Eiran. Now, postmenopausal bleeding can be presented in any form. It could be presented as a spotting, as a pinkish discharge, a heavy menstrual cycle, or bleeding after sexual intercourse or postcoital bleeding. Now, why is postmenopausal bleeding important? Because postmenopausal bleeding can be due to as simple benign cause as atrophic vaginitis, which is thinning of the lining of the vagina, or endometritis, which is thinning of the lining of the endometrium that can happen because of the lack of reproductive hormones during menopause. It could be because of endometrial polyps, it could be because of infection of the reproductive organs, it could be because of endometrial hyperplasia, which is thickening of the endometrial lining, which can happen because of the imbalance of estrogen and progesterone in the reproductive age group. So it could be because of those simple causes, or it could be more importantly because of the malignancies or cancers like endometrium, the uterine cancer, cervical cancer, ovarian cancer. Now, the most common presentation of endometrial or the uterine cancer is postmenopausal bleeding. Hence, it's extremely important that any women, if you has bleeding after menopause, any form of bleeding needs prompt investigation and treatment. Now, the treatment depends upon the cause of the bleeding. If it is atrophic vaginitis, it can be treated with vaginal lubricants, hormone replacement therapy. If it's a polyp, it could be removed by hysteroscopic polypectomy. Endometrial hyperplasia may require a TNC dilatation and curettage and removal of the endometrium. Infections would require antibiotics for treatment, whereas malignancies or cancers would require more elaborate treatment with surgery, radiotherapy and chemotherapy. Once you come to your doctor with the complaint of postmenopausal bleeding, they will do an examination, a physical examination, an ultrasound examination is warranted. Sometimes biopsies are required from the endometrium, from the cervix, to make sure that there is no malignancy. Now, to summarize, when a patient has postmenopausal bleeding, it is extremely important and very, very pertinent to exclude cancer as a diagnosis. And once that is done, then the treatment is possible in a very simple way. So the key home message is postmenopausal bleeding in any form requires prompt diagnosis and treatment. I hope this helps. Thank you.